The Africa CDC says the health system in South Africa is more advanced than in other parts of the continent. It says it is working closely with the South African government to assist where necessary to contain the virus. Before, most African countries were given capacity by the Africa CDC to do lab tests for COVID-19. Many sent their samples to South Africa for diagnosis. Now that South Africa has its own positive cases of the virus, the Africa CDC says it believes the country is well prepared. The CDC director is hopeful that the country's testing infrastructure will allow for earlier detection of the virus, which the World Health Organization has just declared a global pandemic.
South Africa had capacity from the beginning for laboratory testing. South Africa has a capacity for enhanced surveillance, and South Africa also has a decent capacity for clinical management. This means that the cases that South Africa are seeing now, they are able to manage them well to stop community spread. South Africa, having been one of the very first countries that built capacity for laboratory diagnosis, is able to test as potentially people under investigations are found. South Africa is able to test rapidly and therefore respond quickly, which is much better than other countries in Africa.
So far, over 100 positive cases of COVID-19 have been reported in parts of the continent. The Africa CDC says the continent has not been caught unaware.
As soon as we realized that there was an outbreak in China, we embarked on building capacity within Africa CDC and also within countries that we deemed as being highly at risk. That preparedness is paying off. That is why we are picking out cases very early, and that is why we are able to manage the cases and avoid community transmission.
But as the pandemic grows, the CDC says it doesn't have enough funds to keep operating as fast as it needs to.
We don't want the socioeconomic fabric to be disrupted, because when that happens, then a lot more problems will come with the economic downturn and with the inability of people to meet their daily needs. And this may pose some peace and security issues, and we are trying to avoid that. So the resources we have are still meager. We need more, and we are in conversation with our different partners to see if we can be able to mobilize more resources. We are encouraging governments to do the same at country level, so that they are able to identify local domestic resources and also mobilize resources from partners to be able to be better prepared, and those who already have cases to manage and contain them and avoid community spread.
The Africa CDC received $5 million from Bill and Melinda Gates Foundation in February. The Skoll Foundation, a US-based private foundation, has now offered the Africa CDC $7 million to help it assist countries respond faster and more effectively. Coletta Wanjohi, SABC News, Addis Ababa, Ethiopia.